You're listening to Evergreen Media Network. I am Cindy Schwartz, and this is the Patient Partner Show. We're on podcast, also on Spreaker and all of the platforms, and also on Talk Radio. Jeannie Roller, today you and I are talking about doctors. We briefly mentioned it in another podcast about doctors unionizing because they're burnout and because of their situations in their work environment. So I don't blame them for a lot of that stuff, and just other topics that you got on the forefront of your mind. So let's get going.
Well, yeah, I've been reading so many articles where doctors in different parts of the country have been forming unions. And, that's a sad state of affairs about our healthcare system if doctors are feeling like they have to have a union. But then, Cindy, it's because of corporate medicine. Most of this is because they feel that they no longer can make decisions like doctors used to make. It has to go through some clerk who decides whether or not, this is what's going to happen. And which to me, myself, that's scary because I think the decision should be between me and my doctor, not between, not based on what some clerk says should happen based upon some rules that an insurance company has.
Well, doesn't this kind of reek of an HMO kind of thing where it didn't used to be back in the day? Again, these podcasts are all our opinions, Jeannie and mine and whoever we have on here. We're not doctors, we're not lawyers, we're not anything like that. We're just trying to navigate the healthcare system, as is all the listeners and everybody else that has to go to a doctor, which, basically we all do at some point or another. But it kind of reeks of HMO, where didn't it used to be where the insurance company said, okay, blah, 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 the money for this, and I might be stating this wrong. I never had an HMO myself personally. That this is the way we pay for this, so this is what we're allotting for this kind of thing. That's what it sounds like to me.
Yeah, well, and truthfully, Cindy, that's how insurance to me works now.
Okay.
I mean, they will only, like you have to have a certain test before you can get treatment for certain things. So, or you have to have this done before you can have this done, and and with my son, he's a diabetic, and they will only allow certain brands of insulin.
Okay.
It still is like that. And, the doctor will try to override it, and it's like a no.
Okay. So I don't blame the doctors for being... the other thing, too, is doctors are now meeting quotas in a lot of these big box situations, if you will. How does a doctor meet a quota? We've talked about that so many times. You can literally, you being the doctor or the medical provider, can literally spend 10 minutes with a patient. I'm sorry, but that doesn't, and oftentimes... bring about a diagnosis or something. You can't do it that fast. We're all human beings at the end of the day.
Right. And not only that, but, these doctors are being pushed out by nurse practitioners and physician's assistants because these big corporate type places decide that they can pay those people less money.
The less skilled people.
Yeah. And then the doctor is, I think at least in the NPs, most of them, they have to supervise them.
Yeah, that's, to me, and personally to me, that's scary, especially if you have a condition that you've had, I don't want to say serious, but to all of us, it's serious, kind of sounds silly, but a more in-depth kind of, diagnosis.
Yeah.
I personally want the real doctor, for lack of a better thing. I get it. To me, this kind of seems that when you go to get the oil changed in your car, it's okay to go to a drive-through oil change place for your car rather than go to a regular mechanic, if you will. This is what it sounds like to me.
Yeah.
Kind of the same game plan.
Well, and, we know that nurses have unions. And we know what happens when nurses go on strike. Either the hospital closes down or they bring in others, however they get them, to staff the hospital.
Right, yeah.
And, if this is a doctor, I'm not sure I want anything to do with that. I don't like the idea of my doctor going on strike.
Yeah.
And, especially if I'm already in the hospital and the strike happens, I'm like, this. I think it could have some serious consequences.
Well, I think it just lends itself to the fact that the arena and the situation is not what it used to be. And how did this get so far out of control? And at the end of the day, I mean, not for all of the parts, but for many of the parts, it just isn't as good of a quality or health care.
No.
But yet the costs are rising. I mean, which costs do rise, but come on. I mean, how many times are we going to slice this pie? How much profit do we have to make? It's just insane. It loses the credibility of what healthcare actually should be and seemingly used to be.
Right. It does, and it's scary because it makes the patient. I would think if your doctor has to belong in a union, it makes your as a patient, I would think it'd make you feel like, well, maybe I'm not quite as important as what I was before. I think that corporate health care has already given a lot of us that feeling because we feel like we're on an assembly line sometimes when we go to these appointments anymore because, like you say, they only get so many minutes and they're out of there.
Well, we're a commodity.
Yeah.
It's relegated us to being a commodity. I mean, I'm like a 2x4.
Right.
How many times are you going to saw me up, and how much money do I have in my health care plan? I mean, I hunt out and seek the really good care. I said on another podcast, a friend of mine had quite a serious situation going on, and he didn't have the money for the copay for the clinic, the place that he was, and he was steered towards a smaller hospital in a smaller town and is getting, in his opinion, phenomenal care.
Right.
So why isn't that the situation all the time? And he said to me, thank goodness that happened, because he didn't want to be in that other, treadmill, if you will.
Mm-hmm. And then you couple all this in there with the electronic medical records, where a lot of people complain that their doctors never look at them during the consultation because they're typing away. So either you have that extreme case where your doctor's just typing away on a computer, or you have a doctor that is talking to you, then later goes back and types in the information that may or may not at that point be remembered correctly. So, I mean, there is so much about how corporate medicine is being done that spins up my antennas of, I better take a second look at this.
Well, you know what? I've said this before. I got a new cardiologist, and then, I was happy to get in within 6 weeks. I think it wasn't where the corporate one, it was taking me literally the corporate one was 8.5 months to get an appointment. And then before my appointment came up, which was like 2 weeks ago, was supposedly I made the appointment in November. They sent a letter that said the cardiologist is no longer with the practice. So there you go. But in the meantime, I had already sought out a smaller practice and whatever at a different hospital. And do you know, Jeannie, in this day and age, in 2024, I was at the doctor's office in June. Their records are all handwritten. And that practice has, I want to say, 5 or 6 cardiologists. So you can imagine the wall of paperwork was unbelievable, but it's all hand done by the people. Yeah. So it can still be done. They're making a profit because they're in business, and don't tell me it can't get done. Right. Because I see it in the works. I just told you a story of a friend of mine that went to a smaller hospital and is getting phenomenal care. So, I mean, what do we keep coming back to? We keep coming back to this corporate treadmill that they put us on as patients, and if you don't know, you're not the wiser. You just buy into whatever, and hopefully you're getting the right care. I mean, is everyone making the right decision all the time? Absolutely not. We all make mistakes. And sometimes streamlined is better. We all recognize that, but not to the point where you are forfeiting yourself as a human being. That's where I draw the line. I'm sorry. When my veterinarian takes better care of my dog and my cat than the care that I'm getting from my own personal physician or my own personal, office that they've sent me to, then I have to wonder, and I have to do my homework and I have to seek other care. And that's what so many people are doing. And, it's a shame that we have to expend all that energy to do that, which it should be a given because it's an ethical profession, but in a lot of ways, when the dollar sign is the bottom line, the ethics are going out the window with this corporate care. Stay listening to Evergreen Media Network.